皆さんおはようございます。
Good morning, ladies and gentlemen, or good afternoon, good evening. Now we would like to begin the session hosted by the Ministry of Health, Labor and Welfare, Japan's nutrition policy, and we will receive opening remarks from the Parliamentary Vice Minister, Mr. Shimamura, from the Ministry of Health, Labor and Welfare. Mr. Shimamura, the floor is yours. Good morning, ladies and gentlemen. My name is Shimamura, Parliamentary Vice Minister of Health, Labor and Welfare. Thank you very much for your participation in the Tokyo Nutrition for Growth Summit 2021 Ministry of Health, Labor, Welfare hosted event, Nutrition Policy in Japan. Please allow me to say a few words in greeting and opening this session. Yesterday, with the start of the Tokyo Nutrition for Growth Summit 2021, we were able to share our resolve to expedite our efforts for nutrition. The Ministry of Health, Labor and Welfare, which plays a central role in nutrition policy, has established the Tokyo Nutrition for Growth Summit 2021 Ministry Preparatory Headquarters to prepare for the summit. As the head of these headquarters, I'm very happy that we were able to welcome the sessions yesterday as well as today. During this Tokyo Nutrition for Growth Summit 2021, nations must come together with our wisdom in order to solve not only undernutrition and overnutrition, but also the double burden of malnutrition in which undernutrition coexists with overnutrition. Japan has taken initiatives to address undernutrition due to food shortages in the pre-war and post-war era, overnutrition during our economic boom, and more recently, the double burden of malnutrition. We understand today to be an excellent opportunity to share our experiences and knowledge. In this session, Japan's nutrition policy will be discussed, first with an introduction of our ministry's policies, and also through various viewpoints, such as school lunches, research institutes, expert organizations, and international cooperation will be discussed as well. We will also hear from Minister Eng Amgalan of Education and Science of Mongol and Professor Lee Dan Twin of Vietnam, who have worked on nutrition policy in collaboration with Japan. Japan started its nutrition policy even before its economic growth and subsequently in parallel with its economic development, and has now become one of the longest life expectancy nations in the world. By sharing with you the history and characteristics of Japan's nutrition policy in this session, we hope that it will serve as an opportunity to further promote improvement of nutrition in Japan and abroad. Thank you very much.
島村政務官。
Thank you, Mr. Shimamura. Next, representing all the guests today, the President of the House of Councillors, the National Diet of Japan, I would like to invite Ms. Akiko Santo. And he serves as the President of Parliamentary Association for Improving the Nutrition of Mothers and Children. She is instrumental in leading this national policy of nutrition here in Japan. So without further ado, I'd like to invite Ms. Santo. Good morning, everyone. I'm Akiko Santo, President of the House of Councillors, the National Diet of Japan. Distinguished speakers, distinguished guests. First of all, I'd like to congratulate the host for successfully convening this event. And so this is the first time in 5 years, and this is a third and Nutrition for Growth Summit. Stakeholders from Japan and abroad engaged in earnest activities. I'm also involved in the Parliamentary Association of Nutritionists and the Parliamentary Association for Improving the Nutrition of Mothers and Children. They were also heavily involved in discussion. In the world, roughly 9 million people per annum are losing their lives due to hunger. On the other hand, 1 out of 3 are suffering from overweight and obesity. Furthermore, due to the COVID-19, poverty is expanding. That further aggravates hunger. Countermeasure against nutrition problem has no time to wait. And it is opportune time for us to organize such a Nutrition for Growth Summit here in Japan. Here in Japan, even before the World War II and even after the World War II, even the economic situation was not so affluent. We have been putting our efforts behind improving nutrition as well as guidance on nutrition. Our experience and knowledge to be shared with the world while listening to all the parts of the world's the opinions. Starting from today, we are reaffirming our commitments to work together with the world to advance these efforts to promote nutrition. With this, I'd like to end my speech. Thank you for your attention.
SANTOU 先生。
Thank you very much, Madame SANTOU. So now we would like to move on to the lectures. I was delayed in introducing myself, but I will be serving as a moderator. I am from the Ministry of Health, Labor and Welfare, from the Health Service Bureau and Health Service Section. My name is FUKUSHIMA. And because we have time constraints, we will ask questions as time allows. So first, we would like to move on to the first presentation, The History of Nutrition Policy in Japan to Leave No One Behind. Dr. Fukushima Yasumasa, Vice Minister for Health and Chief Medical and Global Health Officer, will give the presentation. The floor is yours, sir. Good morning, ladies and gentlemen. I serve as the Chief Medical and Global Health Officer at the Ministry of Health, Labor and Welfare. My name is Fukushima, and I am very much pleased to be here with you today, and thank you for participating in this session on nutrition policy in Japan. And we had initial greetings from Madame SANTOU, and we also have members from the organizations such as JICA, as well as the Japan Dietetic Association, as well as the National Institute of Health and Nutrition and other organizations. So when we talk about nutrition policy, it covers a broad range of topics, but I would like to talk mainly about what our ministry is responsible about in terms of the policy, and look at the history of leaving no one behind and how things have developed thus far. In terms of the nutrition policy in Japan, it has quite a long history. As you all well know, nutrition outcomes are vital to achieving the Sustainable Development Goals, the SDGs. Given this backdrop, Japan started its investment in nutrition even before its economic growth, and it has met the challenges at the times as they have changed, and has achieved economic expansion in parallel, and has now a top level of longevity in the world. And nutrition policy addresses people's life courses from when they're born to when they age out. And also, we also reach out to the sick and wounded and disaster victims to make sure we leave no one behind in society in nutrition policy. And this is shown here in this diagram. It starts in 1960 on the graph, but before that, before we had our economic growth, we already had promoted and developed a nutrition policy, and that's a very important point. So Japan front-loaded its investment into nutrition, and as we developed our nutrition policy, we in parallel achieved economic growth as well as longevity as well. And I'd like to go through each of these one by one in terms of the history. So in the first stage of our history, as it shows here in the title, we had to address nutritional deficiencies. Japan has suffered various climate changes as well as cold weather, food shortages, and nutritional deficiencies more than a number of times. For Japan, it was crucial that we improve our nutrition to develop our nation. In order to do this, we needed to make sure it was based on scientific evidence. So based on that, in 1920, the National Institute of Nutrition was established to conduct basic nutrition research. This is now changed its name, but it's still in existence. And it's also important to train our human resources as well. In 1924, the nutrition specialists started to be trained in private institutions. And then in 1937, the Health Center Act was enacted, and they were established as hubs to promote health and nutrition in the communities. After World War II, there was a severe nutritional deficiency in the population due to food shortages. But because we had laid these stones, preparatory activities in advance, we were able to carry out nutrition surveys immediately after the war, and we were able to receive food aid based on this data. And then in 1947, the Dietitian Act was enacted and thus officially recognized a dietitian's status. So even before economic growth, Japan built a system to collect scientific evidence and trained nutritional specialists and built hubs in the local communities for improving nutrition. And through these activities, we were able to overcome nutritional deficiencies in about the 1950s. After the food shortage era, we had an era of transition in nutrition, and we had to tackle the non-communicable diseases as well. So we started to have in law dietary counseling and national nutrition surveys with the 1952 Nutrition Improvement Act. In 1956, nutritional guidance car services started, where people were given guidance about nutrition. Local volunteers would provide residents about information about healthy eating habits using ingredients and reasonable cooking methods. In 1961, we were able to achieve universal health coverage. And some of these key points are shown here in the graph. I mentioned that in around 1950s, we were able to overcome nutritional deficiencies, but the black line is the death rate by tuberculosis, and we see that this declined significantly at this point in time. As you know, tuberculosis is very much related to undernutrition. In 1952, with the Nutrition Improvement Act in place, and we see that it decreases into about 1960, and in then 1968, we became the world's second largest economic power. But with the economic expansion, Japan started to have issues with overnutrition. Obesity and NCDs were on the rise. With this, Japan decided to have a national movement for promoting health. The 1978 National Health Promotion Plan, the first plan was to promote health to the wide public and to develop systems to provide community-based health services. This would include health checkups and guidance, establishing community health centers in municipalities, and placing public health nurses and dietitians there. Then 1988, the second plan was enacted, and health promotion projects focused on exercise and physical activities. So Japan focused on measures based on human resources as well as physical locations as well. After that, Japan went into an era of aging society with low birth rate, and we needed to deal with more complex nutritional challenges. You can see here on the graph, the blue is a population 0 to 14, green is 15 to 64 years of age, red is 65 to 74 years, orange is 75 years and over. The blue shows you the ratio of people under the age of 14, and we see it goes down continuously, and the red line indicates the population 65 over, and orange is 75 and over. And we see that these trends are on a continually increasing trend. And in order to deal with these changing situations, in 2000, we put in place measures to be able to deal with more complex nutrition challenges. In 2000, we had the Dietitian Act that was amended and had the Long-Term Care Insurance Act, and we also had the Third National Health Promotion Plan and Health Japan 21 to improve social environment. In 2002, the Health Promotion Act was enacted, and this would be looking into and encompassing the other acts as well. Then 2012, we had the Fourth National Health Promotion Act, Plan Health 21. And so various countermeasures were reinforced in Japan for nutrition and also covered long-term care and health care and other areas as well, so that we had a comprehensive policy in place. As I mentioned before, Japan's nutrition policy is based on diets, specialists, and evidence, as I mentioned before. In the past and also into the future, we will continue to value these three areas as we move forward with our nutrition policy. As I mentioned at the very beginning of my presentation, nutrition policy in Japan leaves no one behind. This is one of the characteristics of our policy, and this really matches well with the SDG principles as well. One key point here is that our nutrition policy covers all life stages. Specifically, no matter where you are, no matter what age you are able to receive a routine health checkup, and we are able to monitor the health status of our people, and if necessary, interventions are provided as well. And for the elderly, we emphasize measures to prevent undernourishment and frailty. The second point is that we also make sure there are measures for sick and wounded persons as well. We have public health insurance in Japan that covers detailed nutritional care for inpatients and outpatients as well. So the nutrition is integrated into UHC in Japan. The third point is regarding nutrition for disaster victims. In Japan, when a large or major disaster strikes, we do provide support for nutrition of the disaster victims. the people in the evacuation centers need to have a certain amount of energy, and we set reference intakes of energy and nutrients for dietary management at these centers. And also, we developed a simulator for municipalities so that they can estimate the required amount of food stockpile for populations, including those with special consideration. And for disasters, we provide nutrition and dietary support as well. So as I have explained, Japan has started its nutrition policy prior to its economic growth and has integrated and developed nutrition into healthcare and other systems. In parallel, we were also able to achieve our economic growth and became one of the top countries in terms of longevity. One of the topics here is about nutrition being integrated into UHC, and Japan is a forerunner in this area. And we will continue to refine our nutrition policy that leaves no one behind. We have more than 100 years of experience in nutrition policy, and we hope that we can utilize our experience so that we can work with academia and various organizations and government as well. And each of the organizations coming together so that we can build a sustainable society, and we hope to contribute to this as well. So I hope that this will contribute to that effort. Thank you very much for your kind attention.
Fukushima.
Thank you, Mr. Fukushima. Next speaker is, he will talk about the role of National Institutes of Health and Nutrition for the sustainable healthy diet. And Dr. TSUGANE Shoichiro, Director of National Institute of Health and Nutrition. Good morning, everyone, or good evening, rather. I'm TSUGANE, Director of National Institute of Health and Nutrition. As a previous speaker mentioned, when it comes to nutrition policy here in Japan, we are here to support the scientific evidence. I think that is the role played by the National Institute of Health and Nutrition. Next page, please. And so the National Institute of Health and Nutrition was established in 1920 as the State Institute of the Study of Nutrition. And so Mr. Saiki Tadashi is the first president. And it became the independent administrative agency, and it was combined with the National Institute of Biomedical Innovation. And so the last year celebrated 100th anniversary. And so food reference intakes and the development of a standard table of food compositions and the starting of the National Nutrition Survey is something that we have contributed to. So those are the instrumental in the providing scientific evidence to the making the nutritious policy in Japan. There has been revised many times, and not just the researcher or experts in this area, but we were also heavily involved in the human development, such as the dietitians. And so the mission of our institution is to conduct survey and research on the relationship between food, nutrition, dietary habit, physical activity, and health by ourselves, and also through our coordination as a domestic hub, and to promote research necessary for the formulation of the health and nutrition policies based upon the scientific evidence, thereby contributing to the extension of the healthy life expectancy and elimination of the health disparities in Japan and in the world. And the research focuses includes a basic and epidemiological research to create scientific evidence on diet, nutrition, and physical activity that contribute to the extension of the healthy life expectancy. And also a proposal of a guidance for the healthy diet and physical activity based upon the best available scientific evidence, and dissemination and implementation of research of established healthy diet and physical activity, And so development of effective methods to promote individual healthy behavior or the healthy sustainable food environment. And also international cooperation and regional collaboration are also essential when it comes to our activities. And so this is the National Health and Nutrition Survey. And so it was first studied in Tokyo in December 1946. And so the first purpose was to get basic information to supply food to people. And the 29th, it was spread to 29 and the prefectures. And in 1948, it was spread to 46 prefectures. And so the National Health and Nutrition Survey was also started in 2003 in accordance with the law. And at the National Health and Nutrition Survey, for the 1999, we are in charge of consolidating all this data. And that is a position as a legal work. And the subjected area is selected through the random sampling, and the physical situation and the lifestyle situation and nutritional situation of the people are to be surveyed. So this is a comprehensive survey. And so every year we are continuing with the National Health and Nutrition Survey by doing so. And so we can monitor the intake of nutrition and food here in Japan. And energy intake in 1996 and 1903, and it was increased to 2000 and some. And so after the oil crisis in 1970, and economic high growth area ended, and also the assimilation was also happened. I think this was a very unique. And energy intake level was declined at that time here in Japan. In 2011, and 1,840, it was lower than the right after the World War II. And so obesity ratio here in Japan is very low. I think that is relevant to the energy intake. And if you look at the different energy sources, and you can see the quality changes. Right after the World War II, most of the carbohydrates and fat is the little bit over 10 grams. And the energy intake increase, and mostly due to the energy coming from the animal proteins also and fat. And so the rapid increase in the intake of fat is due to the changing the lifestyle or the diet, and gearing toward more of a Western style diet. But in 1970s, in the mid 1970s, I think the number started to flatten out. The carbohydrates and rice is the staple food, but that is a decline in terms of the intake, and so the carbohydrate intake is continuing to decline. And if you look at this, consumption of the beef was very low in the past, and tuberculosis and lung problem was the major cause of the disease. And consumption of the beef was increased up until the 2070s drastically, and it increased moderately. But I think it is overtaking the consumption of other elements of the nutrient. And so since the inception of the National Institute of Health Nutrition, we are studying the intake of energies and nutrition. 1940s, and standard natural requirement for the Japanese is now established, and also the source and also the pregnant women and breastfeeding of mothers, and we have come up with the energy requirements for the carbohydrates and so on. And so after we administrators is in charge of this, and we were also contributor in providing evidence to support that. And so 2020 version of the standard nutrition requirement for the Japanese, and 34 elements being covered. And so that is also used for the school lunch provisions and also the energy requirements for the population. And 2020, and since 1920, the institution was established, and we were focusing on energy studies. And the energy requirement requires not just a scientific evidence, but also there is the policy requirements in order to solve the problems. And so at the time of establishment, as you can see on the left-hand side, and the basal metabolic rate was the major focus of research. And so in order to learn the measurement methodologies, some of us went to US to learn the new methodologies. And however, and now that we have already established such expertise, and then we were instrumental in establishing this. And moving on to the right-hand side, in 2000, we were more comprehensively able to measure this metabolic rate. And so this whole body indirect colorimeters and double labeled water method was established. And so in order to understand the total consumption advantage of the Japanese people, those methods were very instrumental. This is something that you can see. This is example of a food nutrition labeling. What you see on the red are the mandatory, and the vitamins and calciums and so on, those are recommended to be labeled, or the voluntary. In 1931, based upon the scientific research, and we came up with this booklet to cover all this standard table of the food composition, and that is serve as a basic for the standard table of the food composition. And from the following perspective, we've been contributing. First, the legal inspection body to confirm a nutrition labeling value by laboratory analysis. That's what we do. And number two, as a proficiency testing provider organization performing food nutrition analysis across Japan. And the third point is as a research institution to develop and improve analytical methods for nutrition efforts and functional components in food. And 2014 and onwards, and we are also being appointed as a WHO Collaborating Center for Nutrition and Physical Activity. And to work with the WHO in providing technical support to WPR countries in the implementation of vegan nutrition, and also to support capacity strengthening in nutrition surveillance and so on. And the major activities include dissemination of a research finding on surveillance for nutrition and physical activity, and also the NIHN fellowship program, and Asian Researchers Asian Network Symposium on Nutrition, and participation in a workshop and forms of WPRO. Here in Japan, in order to maintain the nutrition and health, and so guidance development for the healthy diet based upon the best available evidence is also available. And on your hand side, you see the Japanese food guide spinning top. And from the FAO and WHO, in order to achieve SDG, and so the guideline for the sustainable health and diet, and to develop national food-based dietary guideline for SDGs by 2030 that define context-specific sustainable healthy diets by taking into account the social, cultural, economic, ecological, and environmental circumstances recommended. And so those new guidelines to be proposed by 2030. And so not just us, but the cardiovascular section. So there are 6 national centers per areas. And also with the support of national institutions and academic societies, as an all-Japan format, we would like to do this. As Japan and healthy food and universal health coverage are the unique foundation that we have, and we have the longest life expectancy in the world. And based upon this national survey data, and the Japanese tends to eat a lot of seafood, and so meaning that it's close to the target for the sustainable diet that is proposed by WHO. So based upon the Japanese diet and the guideline for food or the diet is going to be the reference point for the rest of the world. Thank you for your attention.
ありがとうございました。
Thank you very much, Dr. TSUGANE. And thank you very much to go back on the history and the role that the Institute has played. And next, we'd like to call upon the Dr. Suzuki Shihoko, Vice President of the Japan Dietetic Association. This is Shihoko Suzuki, Vice President of the Japan Dietetic Association. I'd like to talk about the promotion of nutrition policy in Japan and the role of professional associations of registered dietitians and dietitians. The Japan Dietetic Association was established in 1954, and we have about 50,000 members, and we are a professional association of dietitians and registered dietitians. As you can see here, we have dietitians in various areas working as professionals in nutrition. Let me go back in history about the Japan Dietetic Association. In 1926, nutritionists, which are the predecessor of dietitians, emerged. And then in 1945, the Dai Nippon Eiyo Shikai was established, and at the end of the year, it was changed to Japan Dietetic Association. And then in 1947, the Dietitian Act was enacted. 1952, the Nutrition Improvement Act was issued. And in 1950s, there were various nutritional activities that were developed and implemented. And in 1959, we turned from a voluntary organization to a corporation, and we also joined the International Dietetic Association in 1961, and we therefore expanded as an organization as well. In 2000, the Dietitians Act was partially revised, and the responsibilities expanded. The Nutrition Care Station was established in local communities, and the 15th International Congress of Dietitians in 2008 was held as well, and we were able to expand our activities globally as well. In 2011, we started to do work in disaster support as well. In 2016, we were able to establish August 4th as the Nutrition Day, and we have various events each year on this day that connect people with nutrition. The role of the Japan Dietetic Association is to make sure that we leave no one behind in our nutrition policy. We provide the dietitians and registered dietitians that are managing nutrition and be able to excel and achieve their missions and roles. And for this, we are developing high-quality human resources and promoting the nutrition care stations that connect nutrition with people, and also provide activities to provide nutritional support for disaster victims. In terms of human resource development, we are supporting individuals' careers, and we have a lifelong learning system, and we have numerous training sessions that we host. We also work with the government and related organizations so that we can develop dietitians and registered dietitians that have a high-level skill set. In terms of the nutrition care station, we have the registered dietitians and dietitians that are connected with the people with over 360 locations, and we are able to receive people that would like to receive counseling for food and nutrition and other various services that relate to nutrition, including areas that may go into long-term care as well. In 2011, with the Great East Japan earthquake, the Japan Dietetic Association disaster assistance team was put into place, and the various activities for support were put in place, the JDA-DAT. And this was based on the members and who have received training and are available to mobilize at any time. We work with the governments and local communities that were hit by disasters to provide nutritional support, like providing nutritional centers and other support. The Japan Dietetic Association is working in areas with healthcare, long-term care, and education, where our dietitians are working. And by providing detailed support, we are trying to provide support so that we can prevent the NCDs and promote health amongst the population. Also, the registered dietitians and dietitians utilize technology to improve the quality of nutrition-related tasks and contribute to promoting primary health care and universal health care coverage or health coverage in Japan. The Japan Dietetic Association has the knowledge and experiences that has been cultivated over 100 years, and we will continue to contribute significantly to nutrition improvement in other countries as well. Thank you very much.
鈴木副会長、ありがとう。
Thank you, Ms. Suzuki. It was the history of JDA and also the activity took so far. Next speaker is from the Ministry of Education and the MEXT from the Ministry Secretariat, Deputy Director General FUCHIGAMI. Mr. FUKUSHIMA, please. I'm FUKUSHIMA, Deputy Director General, Ministry Secretariat of MEXT. First of all, I'd like to thank everyone here today for your efforts in school health education. Today, I'm going to talk about school lunch at a compulsory education school as a part of nutrition policy. Moving on to the page 2. This is what I would like to cover today. Origin and history of school lunch in Japan, as well as the objectives of school lunch program, and also the current state of school lunch program here in Japan. First, history of school lunch. Moving on to the page 4. This shows historical milestones and how school lunch had changed over time. School lunch first started in 1889 in private elementary school in Tsuruoka City, Yamagata Prefecture, for children. In 1954, the School Lunch Program Act was established, positioning guidance on school lunches as school activities in curriculum standards. Also, in 1968, guidance on school lunches was recategorized as a special activity. Up until here shows 80-year history of school lunch since it is started in 1968. On the right-hand side, you can see some example of school lunch offered back then. Please move on to the next slide. In 2004, the School Lunch Program Act was partially revised to establish diet and nutrition teacher system to integrate guidance in food and school lunch management. A further revision was made in 2008 to clarify approaches to boosting shokuiku in schools. Even after that, further improvements are made to school lunch program as a part of school activities. Next, I'd like to talk about objectives of the school lunch program. Please look at the page 7. School lunches contribute to maintain and promote the health of children by rich diet with well-balanced nutrition, great educational significance in promoting food education, and are important for the sound development of mental and physical health of children. As you can see here, there are 7 objectives for a school lunch program. First, to maintain and enhance the well-being of school children. Second, adopt desirable dietary habits. 3, foster sociability and cooperative spirits. 4th, fostering respect for life and nature and an attitude conducive to environmental conservation. 5. Fostering a sense of appreciation for their labor. 6. Facilitate deeper understanding of traditional culinary cultures. 7. Guide school children to gain appropriate understanding about production, distribution, and consumption of food. Please move on to the 8. Page 8. The School Lunch Program Act, which stipulates the objectives I have just explained, describes nutrition quantity desired to be secured through school lunch, as well as hygiene management standards. Based upon this act, national and local governments are required to make efforts to spread the school lunch program. Apart from this act, the Basic Act on Dietary Education and the Course of Study also highlights the significance of school lunch program. In these efforts, diet and nutrition teachers play a central role not only in guiding children, but also engage in management of school lunch program to serve as a coordinator between teachers and household and communities. Assigning diet and nutrition teacher is progressing since establishment. Lastly, I'd like to share with you the current status of school lunch program. Moving on to the page 11. There are 3 categories in school lunch program in Japan. Full meal style, which is to offer staple foods such as rice or bread, together with the main dish and milk. Half meal style, which offers main dish and milk. And milk style, which only offers milk. Almost all the elementary and junior high schools offer one of the 3 types of school lunch. But full meal style is the mainstream. Next, I'd like to show you some example of full meal style school lunch, which is the most popular type offered at the most of the elementary and junior high school. Each school offers menu which can secure necessary nutrition, and also schools are also conscious about including local produce and local food culture to make it a menu more diverse. Children take turn to bring the food from the school kitchen to their classroom and then to each student. Children are the ones to clean up after eating. All these activities offer significance as a part of food education at school. At MEXT, we will continue to promote measures to enhance school lunch program. Lastly, I would like to, I hope my presentation will help enhance your nutrition policy. I'd like to end my presentation by wishing further development of our nutrition measures. Thank you for your attention.
倫理官ありがとうございました。
Thank you very much, Mr. Fuchigami. And I think that internationally there's a lot of attention for Japan's lunch system. So I have a question for you.
ありましたら教えていただけ。
Could you tell us what you focus most when it comes to school lunch? Yes, education through school lunch, what I'd like to focus most, or our ministry most. As the page 7, could you go back to the page 7? As you can see here, the objectives of the school lunches, there are 7, as I said earlier. And out of these, the second one. So non-balanced diet or not having breakfast, so irregular diet habit or obesity or underweight, extreme underweight, in order to solve this problem. And so proper understanding of a daily dietary habit is needed. So it needs to have a capability to solve on that they can achieve the very desirable dietary habits. Thank you very much. So lastly, I would like to ask about how the school lunch program in Japan should be in the future. Yes. As I mentioned today, when it comes to school lunch program and nurturing the desirable dietary habits and fostering understanding of the food, in that sense, the role of a school lunch is a very instrumental. So the school lunch itself needs to expand further and also improve the quality further. And that's something that we are going to continue to do. But within the context of a school education, through a different subject, and the school lunch should be used as one of the learning tool. And so, centering around the diet and nutrition teacher, we would like to make utmost efforts to improve the nutrition level. Thank you very much. So, school lunch program in Japan not just provide a lunch, but also the guidance is provided by the diet and nutrition teachers. That is a major features of this.
海外の
So next, moving on to talk about the sectoral nutrition support initiatives abroad. We would like to invite Mr. Tadashi Sato, Vice President of Japan International Cooperation Agency, to give a presentation. Thank you very much for the introduction. From JICA, the Japan International Cooperation Agency, my name is Sato, and thank you very much for inviting me here today. And I'd like to talk about international nutrition cooperation based on Japan's experience. And the speakers thus far have talked about Japan's history and policies, and I would like to talk about how we actually use that experience for international cooperation, using some specific examples. JICA is Japan's ODA implementing agency, and we promote international cooperation. For example, we accept trainees and dispatch experts. We also have our Japan Overseas Cooperation volunteers. And we have partnership programs with Japanese organizations and companies as well. And we also have collaboration with international partners. JICA emphasizes contribution to human security. That is part of our mission, and therefore we prioritize cooperation for nutrition in developing countries. The areas are promoting efforts to address overnutrition and undernutrition, the double burden of malnutrition, targeting vulnerable populations such as children and women, emphasizing empowerment and ownership of people, organizations, and societies, promoting multi-sectoral efforts, and promoting multi-stakeholder initiatives. And we have been working in the field in the development cooperation, focusing on these areas. In JICA's activities, we utilize our own experience in Japan. That's one of our characteristics. As mentioned before, we have achieved a society of health and longevity, and this has generated strong interest among other countries. These areas would include the health sector with the National Health and Nutrition Survey, as well as nutritional specialists and the Maternal and Child Health Handbook, agricultural and food sector, and also water, sanitation, and hygiene and education sectors. And these various initiatives had contributed to decline in infant mortality rate since before World War II, longest life expectancy in the world, and lowest rate of overweight and obesity among OECD countries. Now I'd like to talk about some examples of our actual activities. In JICA, we have been working with various government officials and professional human resources from developing countries, and working with our partners in Japan, we have provided opportunities for them to learn about Japan's nutrition system and practice. On the top left, we have improvement of maternal and child nutrition. We have opportunities to learn about how to develop those policies. And on the top right, nutrition improvement through agriculture. We provide experience about how to improve nutrition through agriculture and how it can be applied in Africa, for example. And left bottom is in the island areas. We are providing training on non-communicable disease prevention and control in remote island regions, and looking at the aging society and providing information about that experience. Bottom right is Vietnam Nutrition System Establishment Project, and this is one of the programs that has been done with the private sector, and JICA is working with this as well and providing support for these efforts. Next is what we have been working in terms of providing technical support in trying to promote the health status improvement. First is the Maternal and Child Health Handbook, which originated in Japan and strengthened continuous care for mothers and children and utilization for nutrition. Some of the examples here on the left is from Indonesia. This is they have developed the handbook from 1993 and introduced it nationwide. And they do use it for medical checkups for both mother and child. And on the right, we have various, or rather, they actually drive the promotion of the handbook now in Indonesia. And then on the right, we have Ghana, and this is a project for improving continuous care for mothers and children through introduction of the handbook. And illustrations are used in an easy to understandable manner so that nutritional guidance and counseling can be provided. In agriculture and food sector, we have been working on nutrition-sensitive agriculture and rural development. We've been working with the African Union Development Agency with the IFNA, Initiative for Food and Nutrition in Africa, and it is a multi-sectoral intervention activity. So on the left is an example of Mozambique. The agriculture, health, and WASH is the areas that we're working on so that we can derive synergies. For IFNA, on the right-hand side, we have been working on promoting agriculture, which is focused on nutrients. In Ethiopia and Rwanda, we do an analysis of the diet and identify what items should be produced and providing intervention. In water and sanitation and hygiene, WASH area, we are working in development of urban and rural water supplies, hand washing facilities, and hygiene awareness. And this is an imperative for resilience to climate change and also for nutrition to improve water supply. And we're also trying to raise awareness of hygiene and hand washing as well. In the education sector, we are sharing our experience of shokuiku, food and nutrition education, and also the improvement and introduction of school lunches. For example, in Madagascar, we have the Everybody's School project, which is an area where we can communicate. It's collaborating in the school management. And during the off-season of farming, schools are providing form to provide meals to children. And in Malaysia, the idea is to implement the shokuiku approach so that people eat healthy since they are young. We have visits to schools and dispatch of experts and visits to Japan. So the training is very much practical so that we have a continuous support up until actual policy development. In Mongolia, there is a well-balanced school lunch service that is going to be provided. We develop nutritional intake criteria for children and preparing menus, as well as human resource development and improving systems to provide those food as well. And we're also providing support to strengthen administrative capacity. This is the last example here for the Tokyo Nutrition for Growth Summit 2021. Yesterday, the high-level side event that we hosted, we did declare our JICA Nutrition Declaration. This is a basic approach summarized into 10 points in terms of how we will approach nutrition. The multi-sectoral approach, utilizing Japan's experience and other aspects are shown here. And this is in line with the government of Japan commitment as well. So JICA will continue to promote our efforts, and I hope that we can work with you as well and work with international organizations and stakeholders so that we can improve nutrition across the world. Thank you very much for your kind attention. Thank you very much, Mr. Sato. I have one question. So in various countries, you've been looking at water, hygiene, agriculture, and food and health. So as you look at this, what are any, if there are any, challenges in efficiently and effectively promoting multi-sectoral efforts? Well, when we look at the developing nations, we see that great synergies can be achieved with this approach. But one challenge, of course, in Japan as well, is that depending on the sector, there's different agencies that are involved. And the approaches or targets would be different depending on the agency or authority. And that is a challenge. So how to coordinate and collaborate amongst those different organizations is going to be the biggest challenge. In order to address this, what is necessary is that each of the related sectors and organizations, departments, really have a full appreciation for the importance of improving nutrition. Based on that, what potential actions can be taken needs to be considered. So on the central government level, especially in developing countries, in the last 10 years, there's a national nutrition organization, and capacity building in those organizations would be another challenge. And also, I believe the most important is the cooperation on the ground. The donors in various organizations having good communication of information and look at the same region or have common goals and common approaches. Those are some ideas. And JICA, with the Mozambique project, this is something that we are promoting as well, and we hope to move forward in that manner as well. Thank you very much. In terms of contributing to human security, multi-sectoral nutrition support has been provided by JICA, which was just presented. Thank you very much.
And so from the National Institute of Nutrition, Vietnam, from the Professor Lee Dan-Duan, he will talk about the collaboration between Japan and Vietnam on nutrition. This will be the online presentation. And so Professor Lee Dan-Duan is also served as the president of Vietnam Dietetic Association. He has made great connection and supporting and for collaboration between Japan and Vietnam on nutrition, especially nutrition course of dietitians. Now he is head of a nutrition department of Public Health University, as well as a visiting professor in other universities in Vietnam and in Japan. And so Professor Lee Dan-Duan, hello? Are you ready? Floor is yours.
Permit me to present about the collaboration between Japan and Vietnam on nutrition. My experience consists of three parts: country profile, overview of dietitian system in Vietnam, and lesson challenge. Country profile. Vietnam located in the Southeast Asia, and And life expectancy for men 71 years, and for women 79 years. The top 10 cause of death in Vietnam, blacklist, first stroke and heart disease and diabetes. Diabetes also in the top 10 cause of death in Vietnam, blacklist. And NCD estimated account for 77 all death in Vietnam. If we talk about blacklist, and we talk about the prevalence of stunting in Vietnam, and in past, in the 13 years before, prevalence of stunting underweight and stunting very, very popular in Vietnam. Even we can meet the Maramut and Kwasiokor not only in hospital, also in the poor commune when we conduct the anthropometric survey. And now prevalence of stunting in Vietnam below 20%. 19.6%. Next, please. Next, please. We talk about trend of energy intake and the macronutrient. Energy intake in the year 2020 was 2,000 kilocalories per capita per day, and percentage of energy intake from protein and fat are on increase. Percentage of energy intake from carbohydrate are on decrease, but it's considered that as a balance based on the recommendation for Vietnam's people. Next, please. And we mentioned about the change of food consumption in Vietnam. We do not have a time to introduce in detail about this change, but we can talk another chance. But vegetable and fruits are on increase, but not at the recommendation for WHO for Vietnam's people, and also WHO recommendation. Next, please. Mention about trend of overweight and obesity in adult people in Vietnam, both in rural and urban area. Prevalence of overweight and obesity are on increase. Next, please. The overview of the dietitian system in Vietnam based on the Japan model, because that we have the similar food culture, food pattern in Vietnam and food pattern in Japan. Similar, that's assessment by some professor, Japanese professors, they come to Vietnam. And the National Institute of Nutrition was established in the year 1980, and after the war, the people in Vietnam, they suffer from a lot of disease by the hunger, by the health problem, and nutrition and dietetic. So that is very important for Vietnam. Next, please. From the year 1985, Dr. Kobayashi, Japanese National Institute of Nutrition, Professor Yamamoto of FUKUSHIMA University, and Professor Nguyễn Văn Chuyển from Women University started the support to nutrition education and research. Many Vietnamese was invited to FUKUSHIMA University and other university by Japanese government scholarship, and they learn nutrition and dietetic, and they obtain PhD there. In the year 2010, like place, Vietnam has seen lack of dietitian personalhood in the hospital and community, and asked cooperation to Japan Group for education of nutrition and dietetic. In the year 2014, academic agreement for cooperation of nutrition and dietetic education was signed by 5 groups, 3 groups in Japan and 2 groups in Vietnam. In Japan, Dietetic Association, Kawasaki Prefecture University, where Professor Nakamura working, and Zumuri University, where Professor Yamamoto working, and 2 Vietnamese group, National Institute of Nutrition and Pan-American University. So the training system on dietitian have been established since then from Pan-American University, and now expanded to other 5 to the 8th university in Vietnam. Under this agreement, Japanese group set more than 20 instructor nutrition and dietetic. We very happy with them because next place and they come to Vietnam, they work very hard with us. And Vietnam, there are few specialists in the few Japanese 3 group have been continuing support for young dietitians, and now there are about 10 graduates are learning nutrition and dietetic at graduate school in Japan. Next place. Government set the job code for dietitian. Vietnam Dietetic Association have been established in the year 2019. In coming year, the registered dietitian system will be built, improved, and standardized in Vietnam. Some Japanese company also help us, like Ajinomoto, Kao, Franco, so on. Next, please. Lesson and challenge. We learn many things by our cooperation. Dietary management system at hospital in Vietnam, there are not much dietitian specialists, and dietitian cannot care for patients who's poor by lecture, by also doing practical activity. We learn many things from that. We never thought that the dietitian can play so important role in hospital. Special diet of sickness activity of nutrition supporting team by dietitian, doctor, nurse, and other medical staff. Next, please. School lunch. Japanese system is great, and school dietitian are one of our teachers. And we visit some school in Japan, and that's excellent for us because we can observe children not only have a knowledge from nutrition, but also they work of many people from farmer, fisherman, transporter, cooker, and many people not only in Japan and other countries. Children also learn that they are eating liver of animal and vegetable and appreciate for their liver. Such experience make the spirit of Motanai. We will try to apply the model in Vietnam in future. Only registered dietitian can give a nutrition advisory for patients and get money. That's the essence for Vietnam because we don't do that now. We thank you very much, Japanese government, for great support. And the challenge is the process of building dietitian system in Vietnam. And we had the system of bachelor, training bachelor of nutrition, master, PhD now, and we had the training curriculum, but we don't have a national exam in order to deliver this license, and so that we don't have a registered dietitian. That's a very big challenge for Vietnam in the future. And also, there are not much teacher consultant for this field, and number of dietitians still small, so that we need more cooperation from Japan with the Japanese experts in order to help us. Thank you so much.
リーダンチェン先生、ありがとうございました。
Thank you, Professor Lee Dan-chen. And so, model after the Japanese model, and they came up with a dietitian's system. So, in what areas the dietitian can play a bigger part? Which field the dietitian can play a bigger part in Vietnam going forward?
In fact, our system of dietitian network is still young, so that we don't have enough experience for develop the network in the hospital and also expand to school and in the day center, community health center, nursing home. Until now, we have a little experience about this field. Therefore, we hope that our cooperation will develop and continue, and we will have develop for the lesson for dietitian people, and they can work very well in at hospital and at commune and at school. Thank you.
ありがとうございます。
Thank you very much. Earlier, in your presentation slide, and Professor Benjamin Chu, I learned from him, and in Vietnam at university, and he was saying that he wanted to set up a dietitian system in Vietnam as well. And so now you have this dietitian system up and running here in Vietnam. I'm very happy to hear that. So thank you very much for your time, Professor Lee Dan-chen, for your time.
Thank you.
Next is the last lecture, and we will invite the Minister of Education and Science from Mongol. Minister Eng Amgalan will be giving his speech through a video message.
Distinguished guests, ladies and gentlemen, greetings to all participants of the Nutrition for Growth Summit 2021. It gives me great pleasure to share with you today my views on child food and nutrition in the education sector. Nowadays, the concepts of accessing the development level of countries not only measured by level of economic growth, but by the competitiveness level of the human element. The purpose of education is not only impart knowledge, rather it is to develop world-class education that acknowledge the wisdom of being human. Therefore, the Mongolian government is focused on providing healthy, nutritious food to every child, providing them nutrition education, creating safe environment, improving quality of education through the development of right person, and providing them higher education. The following is main content of my presentation today. As of today, there are more than 700,000 students studying 848 secondary and primary school. Due to COVID-19 in Mongolia, we are utilizing blended learning methods. We conducted primary education assessment in 2005 in order to determine factors that affect the quality of primary education positively and negatively. The assessment demonstrated that socioeconomic development, urban, rural gaps, household livelihoods, family environment, the schools, and learning environment are all contribute to academic performance. In this case, it simply indicates whether the child is hungry or not at the school. The child who are hungry in classroom are rated as less academically able than their non-hungry classmates. For example, they scored lower in mathematics by 7 to 13%, in Mongolian language by 12 to 18%. Therefore, to improve the quality of education provided to Mongolian children, the government of Mongolia has begun to provide lunch program to over 100,000 children in grades 1 to 2, starting from 2006. Our lunch service program had gradually increased to all grades that by end of 2008. Lunch was available to every primary and secondary student in Mongolia, according to audit report. Introduction of lunch program for primary school students resulted in a reduction in school dropouts as well as greater focus on aptitude for learning among students. An examination of the nutritional status of Mongolian conducted by Ministry of Health in 2017, it revealed that micronutrient deficiencies have increased among young children, and most of these deficiencies resulting from poor dietary habits. A research-based policy recommended that to prevent micronutrient deficiencies, it is necessary to increase the quality of food, to educate consumers about proper nutrition and to provide nutritious food. Mongolia is a nomadic country of 4 seasons and unique and traditional culture of food processing and storing. After transition to democratic and free society, the transition to sedentary culture began to create legal environment to regulate multilateral relations. In 2016, the law of organic food was adopted to regulate the production, certification, sale, import of organic food, forage, and fertilizers during the development of agriculture industry. Law on food of infant and youth children and law on fortified foods was adopted to improve the nutritional status of youth children and prevent micronutrient deficiencies and meet their needs. In 2019, law on food production and services for secondary school was adopted in order to reduce weight and obesity of the school-age children, promote proper food consumption, and create healthy Mongolian in the future. Also, based on the result of the research studies, health education curriculum has been added in secondary schools in framework of the six groups of the content, and 1 group of content is topic of nutrition and exercise. This group is not only taught the students how to choose, store, process, and play role in their bodies, but also taught them how to eat properly. According to law on food production and services of secondary schools, equally involve students by safe, nutritious food based on professional human resources in designed environment based on local livestock on soil, growth, processed food, raw materials. It will also monitor implementation of the law by providing systematic nutrition awarenesses to stakeholders and ensuring parental and community participation. As of today, 400,000 students in grades 1 to 5 are receiving lunch service during the school years. In implementing the law on secondary school food production and services, we identified the following 5 sets of issues and challenges. First, identify source of cost of preparing nutritious meal that is appreciated for the students all age. Government will continue to fully cover cost of lunch services, or shall we share cost of meals of parents? That was challenge. Taking into consideration COVID-19 pandemic, the country's social, economic, and psychological situation, government has decided to fully cover cost of lunch. Second, during the implementation of the law, there was needed to be supplied dedicated equipment about 70% of all schools. This is being done by adopting and implementing procedure for receiving donations within framework of social responsibility of citizens and businesses. The third, the law requires that every school have nutritionist. Mongolia has been implemented degree program as nutritionist since 2005, has been trained more than 100 professionals, but most whom work in health sector. Therefore, there is needed to train doctors who are currently working at the secondary schools to become nutritionists in short period of time of quality program. The fourth, we see the importance of proper management of the food supply system, making full use of local resources to ensure that the schools are providing of the safe food products. In other words, when it comes to food, the education sector is consumer. Therefore, the quality and safety the school meals should be measured by the result of multi-stakeholders cooperation. Then finally, fifth, to have system that constantly improves knowledge and the skill of these working in the school food industry. It was necessary to determine which programs and methods should be used to train cooks, how many years, which government agency should be trained them. We have requested the support of JICA on 3 of 5 issues raised in this slide. Within the framework of this work, preparations are being made to implement projects to support production and service of school lunch from 2021. We all know that Japan has long history of implementing school meal laws and nutrition education law since. The system of training nutritionists and use of locally produced food in school meals have significantly improved nutrition education of population. The Japanese school food production, service, and nutrition education system for children has become model for other countries. So 4 key methodological shown in the slides need to be introduced in Mongolia. That's why we are expecting 3 major results from this point project of JICA. First result is model of food service that provides nutritional balance to students in a school environment. Second, model of optimal food supply system based on local characteristics. Third, we hope that project will be successful in changing knowledge and attitude of stakeholders in school lunches, including government agencies, schools, parents, caregivers, and food producers. It was stated in the State of World's Children Report, which is publication of the United Nations, that every dollar that is spent on school lunch is equivalent to 9 in return, adding the value of many areas, including health, nutrition, social security, and agriculture. In Mongolia's long-term development policy vision 2020-50, there is goal set to develop a country of healthy, educated, patriotic, flexible, intelligent, and creative citizens. Mongolia's education sector will take lead in providing quality education to everyone, supporting the bodies of safe and nutritious food, and preparing healthy Mongolians in order to have world-class intellectual population. It is important for everyone to understand that school lunch is source of certain amount of nutrition that child needs to grow up healthy and achieve the academic goals. We would like to thank JICA for its dedicated work, the well-being of children and bright future of Mongolia. Let's reach the end this presentation of Mongolian Prof that says there is healthy mind in healthy body. Thank you.
Thank you very much, Minister Eng Galan. So from here we have the Mr. Gnamgajal from the in charge of the school lunches here with us from the ministry. So we just had a presentation from the minister, and we'd like to ask a couple of questions about this. So for all of the secondary and primary school children, you have school lunches, and up to now, well, I have now learned that you're trying to improve the health and education of children. But I'd like to ask, what are your future prospects or plans for the school lunch system in Mongolia?
За бүгдэний өнөөдрийн мэнд хүргэе. Тэгээд дагах орчуулгатай явж байгаа.
Good morning, everyone. Due to the technical possibilities, my speech will have consecutive interpretation.
Монгол улс 2006 оноос үеийн цай өгсөн. Тэгээд 2020 онд их хурлаар өгөгдсөн байгаа. Тэгэхээр эхний ээлжинд бол нэг талбар анги буюу бага ангийн үйлдэл орж байгаа. Цаашдаа дундаа ахлах ингээд үе шаттайгаар бүхнийг амруулахаар төлөвлөж байгаа.
School food program started in 2006 with the food snacks. As you know, the law on food production services for general education schools was adopted in 2020. And now we are making efforts to expand our program to cover middle school and high school children.
Монгол улс урт хугацааны бодлогууд үндэсний газрын мөрөөд яг энэ чиглэлээр асуусан учраас бид олон улсын байгууллагын дэмжлэг JICA-тай хамтарч олон улсын байгууллагын дэмжлэгийг бол өргөжүүлнэ.
Based on the law, we also integrated nutrition policy in general and also children's food programs in the long-term and short-term government programs, including the government action program of this current government, as well as the Vision for 50 long-term development programs. So in this regard, with our efforts, we are looking forward and happy to continue our cooperation with JICA in the future. Thank you.
ありがとうございます。
Thank you very much. So it seems that we have learned about the school lunch systems that are taking fully root in the Mongolian system. So thank you very much.
はい。 はい。これで、本日の、講演終了と。
So that concludes all of the presentations for today. We had heard from people in Japan as well as representatives from Vietnam and Mongolia. Thank you very much for the valuable presentations. Nutrition is a part of all the SDGs, and in order for us to achieve the SDGs and also to achieve a sustainable society, each of the countries need to expedite and accelerate their activities, and I hope that this session provided some insight into how to do this in the future. So thank you very much. We did exceed our time a bit, but this is the end of the session regarding nutrition policy in Japan. Thank you very much.